There is only one remedy that can lower creatinine levels by 13% in just 1 month, even in stage 5 kidney disease patients. Welcome everyone, my name is Catherine if you are new here, and I've been working with people suffering from kidney disease for almost a decade now. Today, I'm going to show you how to use this little known remedy that, according to science, can literally drop your creatinine levels in just 1 month. This is a remedy that's often used as a weight loss pill and a cholesterol lowering supplement. It works by binding to cholesterol in the intestines, but it doesn't just bind to cholesterol. What's so amazing about this remedy is that it blocks the absorption of many substances that cause damage to your kidneys. This remedy is derived from the exoskeletons of shellfish, chitin, which has the peculiarity of actively absorbing fats and another kind of unwanted molecule, uremic toxin. Studies have in fact indicated it can be effective in reducing creatinine levels even in people with renal failure. The remedy I'm talking about is called chitosan, and it's just amazing.
Oh yes!
Here's what science says about it. In this study conducted on stage 5 chronic kidney disease patients, the participants had a drop in creatinine levels of 13% in just 4 weeks. Their cholesterol also went down by more than 4 millimoles per liter on average. Their urea was also significantly lower. And incredibly, they also got an improvement in hemoglobin levels. This study was published on the Journal of Pharmacy and Pharmacology, which is a prestigious peer-reviewed scientific paper. And these results are really significant. Improving hemoglobin levels alone is a result worth considering supplementing chitosan. This is the main indicator of anemia. An increase in this level means that there are more red blood cells in your blood and that you are healthier and stronger. Urea levels, a toxin that should be removed by the kidneys, is an indicator of kidney function. If this level goes down, it means your kidneys are doing better. And while these results were observed in just 4 weeks of supplementation, the subjects were even healthier after 12 weeks. Now guys, I know this is amazing, but please watch my whole video before deciding about using this product on yourself. Chitosan also comes with a warning you should know about. This is why today I don't want to just show you this remedy. I want to tell you exactly how to use it to lower your creatinine levels in 4 weeks safely. Now, to understand how to use it, we need to take a very brief look at how it works. As I was saying, this remedy blocks the absorption of cholesterol and other substances in the intestines. Never underestimate the importance of treating high cholesterol. Cholesterol levels are almost always too high in people with kidney disease. This is so common, doctors won't even tell you if you have high cholesterol in some cases. And yet, cholesterol will constrict your arteries at the point of causing serious damage to your kidneys and other organs. This is why you should always keep your bad cholesterol levels under 100 milligrams per dl if you want to lower your creatinine levels. And while chitosan can help, there are some remedies, foods, and good habits that work even better to lower bad cholesterol levels. I've explained what they are in my video up here. But don't go away now. It's time to see exactly how to use chitosan to lower your creatinine levels. The correct dosage for chitosan is 450 milligrams 3 times a day before the main meals. Chitosan should be taken 30 to 60 minutes before eating, allowing it to become activated so that it can absorb the fat and or toxins from the meal. Several other dosages were tested for different reasons, so today we know that doses of chitosan up to 3 to 6 grams per day are perfectly safe. Now, very important. What you should know is that chitosan can deplete the body of certain nutrients such as calcium, vitamin D, selenium, magnesium, and other minerals. Get checked for these nutrients during the treatment and supplement them if needed. Also, people severely allergic to shellfish and people with intestinal malabsorption syndromes should completely avoid this remedy. Now, some brands add phosphate to their products, so double check the label of what you're buying. You do not want extra phosphorus, so I've linked down in the description a product that comes with no added ingredients and that's actually pretty cheap. Now, let's talk about the elephant in the room. Medications that need to be taken with meals. You will need to work with your doctor and adjust your medication scheduling to suit the assumption of this remedy. The safest way is to never take it within 2 hours of other supplements or medications because it could block their absorption too. However, during the treatment period, no clinically problematic symptoms were observed. Chitosan is safe for most people when taken by mouth for up to 12 months, according to studies. Now, the best way to correctly schedule your use of this supplement in relation to the other supplements and medications you may be taking is using an health journal. This is an incredibly powerful good habit you can use to put your kidney health back on track fast. I've explained exactly how to do this in my video up here. And this is all for today. Thank you for watching.